what would you change if you were to say, like, okay, 3 things to every gym goer or everyone who wants to be fit or every sports person?
First thing is education. Diabetes is a lifestyle disease. Focus on laptops, on iPhones. All of these are lifestyle diseases.
If sleep was not so important, evolution would have removed it.
In the next 2, 3, 4, maybe even earlier, robotics will play a pretty integral part in the surgical management of a lot of these injuries.
Welcome to the Odds Fitness podcast. I'm Asad Hussain, the CEO and founder of Odds Fitness. Today we have Dr. Rajgopal, who's the chairman of orthopedics at Medanta. He has tremendous amount of experience. He has some wonderful stories to tell us, some exciting ones. He's also someone who's a little sporty and adventurous. So why not view medicine, life, lifestyle from his lens? So today we have this conversation. Welcome to the Odds Fitness podcast, Dr. Rajgopal.
Thank you, Asad. It's a real pleasure being here.
Thank you for being here. Dr. Rajgopal, you have like many decades of experience. Could you name some lifestyle diseases related to orthopedic conditions?
So the biggest lifestyle disease that is crippling all of us is obesity.
Right.
You'll be interested to know that today we are the 6th most obese country in the world and growing. Diabetes is a lifestyle disease. This focus on laptops, on iPhones, all of these are lifestyle diseases. And directly or indirectly, all of these impact the human body. And from a skeletal point of view, it affects our skeleton, it affects our posture, it affects our well-being, aches, pains, backaches, issues like diseases like carpal tunnel syndrome, cervical spondylosis, low back aches, flat feet. All of these are basically directly or indirectly impacted by lifestyle issues.
Wow. Right. So, in short, like, would it be safe to say your mechanical health sort of depends?
Your mechanical health is so dependent on your mental health and your physical health. I think they're all your body is an interplay of all of these things.
Correct.
And if you don't have good mental health or good physical health or good lifestyle health, I think somewhere your whole being gets impacted and affected.
Right, right, of course. Do you see an increased occurrence of any specific diseases in the last few decades because of an environment of technology, sedentary lifestyle?
Oh, yes, absolutely. One of the biggest things that we are seeing now are aches and pains around the spinal areas. Cervical spondylosis, for instance, a lot of young executives who are spending the major part of their day, evening and night, on laptops and computers are complaining of fatigue in the neck region. With the extensive use of the laptop and of hands, a lot of them complain of issues around the wrist.
Right.
Bad posture, which is almost mandatory when you are doing long lengths of sitting, causes issues around the back. Um, the fact that you're spending hours in the office, most times you're also supplementing that with endless cups of coffee and cookies and biscuits. You really are not getting the time to work out and do. So somewhere your metabolic state, which today it's really become a buzzword, the metabolic health, if you will, is also impacted and affected. And in some way, I guess it also translates into the state of obesity, which in turn again lends itself to diseases like hypertension, diabetes, thyroid as a disorder is very, very prevalent in our part of the world. In our community, in the Indian community, a very large proportion of patients have thyroid disease, and thyroid, interestingly enough, is kind of one of the pivotal glands that controls so much of our human body.
Yeah.
So you mix all of this, and it's a absolutely diabolical mix of a slope that goes down pretty steeply.
Yeah. People automatically think of T3, T4 from thyroid. They forget the parathyroid hormone, which
Yeah,
is so
yeah.
deeply linked with bone
Absolutely.
health.
Yeah.
People also tend to think that bone is like this dead tissue. you know?
Couldn't be a wronger statement, actually.
Yeah.
Bone is so alive, so alive. Very interestingly enough, bone, most of us think of bone as this hard rod, sort of tissue that is just like a strut. It's actually a very flexible tissue,
Yeah.
and it bends, and which is really the basic physiology of bone is it is an organ that bends, not by much, but not something that you can see, but there is a definite sort of bend motion, and consequently, your height when you go to sleep and when you wake up in the morning are different,
Yeah.
remarkably. So that sort of levels, and it's a very, very vascular organ.
Yeah.
I mean, like the brain, the bone is one of the most vascular organs in the human body, something we don't actually give enough credence or credibility to. But having spent almost 40 years handling bones, I can tell you it's one of the most bloody organs in the human body.
Right. Right. Okay. So you were telling me some really interesting stories back there. Could you tell me how some really, really popular people, because we would like to draw some inspiration from them, celebrities? You're telling me about Gopi, who's who's had setbacks with his knee. Baichung Bhutia, who has setbacks with his knee. Rishabh Pant, for that matter. So can we like sort
Talk
of
about them? Sure.
yeah talk about them?
Yeah.
Yeah.
So, well, one of my all-time favorites, honestly, is Gopi, because I was very young in my practice, and Gopi was an upcoming star. So he's one of my favorite sort of cover book stories. I'd like to start by saying that at the time when he had this injury, there was no sports medicine in India.
Wow.
And he was like any other patient. And he was literally brought off the court. He was doing the badminton nationals. The courts were pretty abysmal. And one of the planks on the court gave way and he fell rather awkwardly.
Wow.
And one of his colleagues called me up and said, this person has had this injury. I said, why don't you bring him over? And they flew him in. And I still remember it was sort of late evening when he came in to see me, and I, I examined him. And back in the days, um, we had arthroscopy. We knew pretty much what we had to do. But that was about it. It was a question of a person coming with an injury, you treated it, and then, you did what you thought it was necessary in terms of rehab. I remember speaking to him and to his parents and telling them that this injury is pretty bad. We need to operate. Not having choices, they said, "Oh, go ahead and do it." And when we actually went in, his injury was really catastrophic. He had multiple ligament injuries, and we sat and we reconstructed all of that. And my real journey with sports medicine, in a sense, started there. Um, Prior to Gopi, we'd operated on several of the wrestlers. My sort of career started with operating wrestlers from the Guru Hanuman Akhada and the Chandgi Ram Akhada. We used to do a lot of those medal winners. But we did them and we, told them their exercises. They went on, did their stuff. And we did some of the Asiad winners and so on. But Gopis was a peculiar case in the sense that there was this deep rooted desire in his mind, in his heart, in his eyes, uh, of wanting to get back on the court. I mean, there were news items at that point in time where people had written him off. It's his history. I think somewhere between him and me, we said, let's turn the clock back. Let's prove these guys wrong. And literally, from his perspective, obituaries had been written that this guy is never going to get on the court. And we started, training him, rehabbing him. He was staying at the Jawaharlal Nehru Stadium. And I remember he'd come every day. We'd spend time with him. I'd go to the JNU. And I literally, he and I, we walked together that entire 6, 8, 10 months. And, as he said in one of his memoirs, he said, when doctors said I have to rehabilitate every 2 hours, I rehab, go to sleep, put the alarm, wake up again at 2 hours, do it. So literally, that was an education for me as well.
Wow. Mindset.
Because back at that time, the three things, one was the medical part. Several times he gave up. And why I'm talking about Gopi is because I was very intimately involved with this whole sort of episode of getting him not only knee wise, but from the mental state. I mean, he'd be like, Doc, do you really think I can get back? And yeah, you can do it. And, that was at the sort of our famous two lines. He said, "Or how can I repay you?" I said, "By winning the All England."
And he did that.
And he did that. So
Wow.
it was a great story. And, I mean, even till today, he runs this lovely academy of his in Hyderabad, which I visited and spent some time there. And he's been one of my all-time favorites. So coming back to, or going back in time around that time, we also had the privilege of looking after Bhaichan Bhutia was the Indian soccer captain. He injured his knee. He had a meniscal tear. We dealt with him. Again, put him through that same rehab process. Um More recently, of course, the unfortunate but catastrophic accident that Rishabh Pant, he was operated by a colleague of mine, Dr. Dinshaw, in Mumbai, great surgeon. But again, it is not so much the surgery, it is the rehab and the mental mindset of these guys.
Yeah.
Because you have injuries. What differentiates a Gopi or a Baichang or a Rishabh from the average man who is just happy only to walk versus a guy who wants to perform at that peak apex level? And I think the most classic example of mind over matter over medicine over training is Novak Djokovic.
Yeah. You told me about that.
Novak's 38, possibly in the twilight of his career, but it's remarkable that he underwent a knee surgery, a meniscal surgery, and he was back playing literally 6 or 7 weeks after. And, at that level of or intensity of expectations to be playing on the circuit, I mean, it speaks volumes not only of the surgical technology, but his team, most importantly, his psychologist, his nutritionist, his physiologist, his psychologist, and most importantly, his own self, his family. Somebody needs to egg you on, because these are normal human beings. But what differentiates from a Djokovic from the average person is that motivation, that almost, I use the word craziness, madness in your head, that it's just a surgery, I can go back and do it. And he went back and he did it.
Doctor, if I may ask, what exactly was the surgery about? Did he was it a ligament?
It was a meniscal surgery.
Oh, yeah.
Yeah.
Okay.
So meniscus in an athlete is probably the lifeline for the knee.
Yeah.
And ligament, of course, is the main spine of the knee. But any type of intervention, when you operate on joints, whether it's the shoulder, we've done a lot of back in the days. I don't do shoulder surgeries anymore, but back in the days, we've operated on a lot of the Indian hockey players with shoulder injuries, a lot of wrestlers, because of the nature of the freestyle wrestling, a lot of their shoulders would get dislocated. And because back in those days there was really no real treatment, these guys would get it popped back in, massaged, and they'd go back and pop out again, and they'd do the same thing. So it is basically, in all of these patients, so over the years, I'm very, very happy to say that today's sports medicine in this country is absolutely up there. We have people, we have technologies, we have machines, we have fitness centers. One of them is yours. You guys do all the right things. And fitness, a lot of people think fitness is just going into a gym and pumping iron and getting a six pack.
Yeah.
And that's so wrong.
That is
That is so wrong.
Yeah.
Fitness is a mindset. I think it is a state of health. It's a state of mind. And I just think whether it's a Rishabh or it's a Gopi or a Baichung or Novak or even Tiger Woods for that matter, who's undergone multitude of knee ligament surgeries. I don't quite know exactly how many, but I think three, four, five surgeries, and and then a spine. He had a spine surgery, and then he came back. Even for him to come back to that level, because the level at what these guys play, I mean, it's frightening level of fitness.
Yeah.
So the very fact that you're able to do that, win or lose is another matter, but the fact that you're able to be present in that elite group speaks volumes for resilience, for training, for mindsets, from a psychological point of view, because uh, high performers. I mean, even our own Olympian Neeraj.
Right, yeah.
Neeraj also underwent a elbow surgery, and I read recently he's cracked the 90-meter mark, and God bless him, because it's not only that surgery that does it. The surgery gives you the tools, but you have to pick up those tools, assimilate them, get your act together. And ultimately, it's that belief in your head, in your mind, that, yeah, I have it in me to do it.
Right. I think what I understand from your Gopi story is that you were not only just his doctor or surgeon, you were also his coach in many ways.
Yeah, that was the only time in my life I can brag about that. I beat a world champion in badminton, where he had one leg and I had two.
Right. Right. No, that's amazing. These are very inspirational things, because you have people who sort of have this learned helplessness as well as part of that, and they think that this is catastrophic. But just because you're able to think about it and perceive, now you're talking about solutions and how technology has come so far that the surgery itself doesn't have that much trauma,
Yeah.
because it's so fine, and that you're able to come back, like in Djokovic's case,
Yeah.
so quickly and back to playing.
And also today, when you look at sports injury management training uh, appliances and tools, the development in terms of identifying what are the weak spots. Today, you have machines that will tell you exactly this is the area of the muscle that is involved. You can track the recovery of just that muscle tear.
Amazing.
And you can follow it up. You can get strength trainings. You can get strength assessments. You have sports physiotherapists who will be able to isolate just that little bit of the muscle and train that.
Yeah.
So I think the for an athlete or an individual to go from an injury state to fitness state, there are multiple iterations, multiple levels, there are little steps. But what has changed in the last 35 years that I've been doing sports medicine is today you can pretty much customize treatment for every individual,
Yeah.
each part of the body, each muscle. You can show the athlete that this is where we started and this is your improvement curve.
Yeah.
And when they see that, they're able to assess. So there are lots of. One of the points I wanted to also make is about Abhinav Bindra, and again, Abhinav is somebody that I've been had the pleasure of interacting with, and we've been associated with his training centers. They're doing some absolutely incredible work. So I think when you look at all of these developments from the surgical perspective, from the nutritionist perspective, the psychologists, the physiologists, the mindset, all of this, and of course the rehab process. I think we've completed the circle, and today I think in this country we are equipped to deal with the worst injuries with the best outcomes.
To add to that, very recently, when I was in Manchester, they give us these complicated situations to creatively think about. So we had this one guy, Seb Musson. He's world number 3, number 4. He's a Paralympic climber, and he climbs with one arm,
Oh, wow.
right?
Amazing.
And the wall goes all the way like that, and he's able to do all of those things.
Incredible.
And I was like, people with 4 limbs
Struggle on that.
struggle on that, and this guy is a beast. And then, we did the whole psych evaluation, like you said, because we are like all sports scientists there. So we did the psych analysis. We did the analysis on the, on the dynamometer physiologically to see how each limb strength, what his grip strength is like, etc. All those things. And I think what you're saying about psychology, that plays such a huge role in the way you perceive the world, interpret it, and think about the things that you can do. And I was like, wow, because he had like this big forearm, and usually people would load onto different uh, limbs at different moments of time. And he would have tremendous amount of fatigue because he's also really muscular. And he doesn't know that, because his arm is so muscular, it almost got ischemic at some point and caused more fatigue. And he was like, okay, you know what? With all this data, now he's thinking. We gave him all that information, and he's now thinking, okay, you know what? I can use it like this. I can use. So he is forward thinking. And instead of going like, okay, you know what? This happened. I didn't win this championship. I don't know. He's already thinking of solutions.
Yeah.
I think that's what.
Yeah. So right. I think you need to be a beast.
Yeah.
I think that's the best way. That word pretty much describes. You have to have that insanity in your head. Come what may, I'm going to do this.
Yeah.
And I think that's what differentiates the men from the boys. We're all born with the same 4 limbs and one brain and 2 lungs and all the rest of it. One guy goes ahead against adversity, and the other one gives in.
Yeah.
I think the only difference is in the way you think and how you adapt to that disability. I mean, each time I watch the Paralympics, my admiration for these athletes goes up, manifold, because some of the stuff that they do, able-bodied people can't, and yet they defy, the disability, and all because in their heads, in their minds, they are convinced that they're good enough to compete with the best.
Yeah.
And do it.
Yeah. 100%.
Yeah.
Wow. Amazing. On that note, doctor, how do you decide in a situation whether surgery is needed or not? Like, what would be like because this is such a confusing thing for patients as well.
Yeah.
Do I go for surgery? Do I not go for surgery?
Yeah.
Let's say somebody's lost cartilage in their knees. Some of it maybe can be, managed through exercise, physio, rehab. At what stage does one go like, okay, you know what? Surgery is the only thing that we've got now.
So great question. Let me start by answering that from a perspective of a real life situation. I think 80% of injuries can and should be treated conservatively. Sports injury treatment starts on the field.
Right.
And one of the classic examples I was discussing with you, I trained in Liverpool, and even today, till today, I'm not much of a soccer fan, but each time Liverpool plays and I'm watching the television, I sort of, watch it because that's been my affinity. I grew up in that neighborhood. And one of my consultants was actually looking after the Liverpool Football Club. And my first experience of sports injuries back in the days, I'm talking of the mid 80s, was Ian Rush, who was the first £1 million, athlete contract. And he was playing, I think, Manchester United. He got injured. They picked him up, brought him to our hospital. We operated on this guy. And, he went on to, greater glory and played for his country. So the majority of treatments of sports injuries, first is prevention. So you do all the stuff that is needed to try and prevent having the injury. If unfortunately, in spite of that, you have injuries, the treatment starts right on the pitch or the field or the arena. So timing is of critical importance. Then you go through the usual the rice protocol, and then you need to diagnose those injuries. That is again very very important today with modalities like specialized CT scans, MRI scans, ultrasounds. You're able to pinpoint the injury, and then if you get them really really early, you can start to treat them on a conservative note. Having said that, there is a cohort of injuries which will always mandate surgical intervention. A large muscle tear, avulsion of ligaments, shoulder injuries, finger injuries, knee injuries, fractures. There is no role for conservative management, particularly in these elite athletes. One of the things that happens if you delay is muscle wastes,
Yeah.
atrophy. It atrophies in days, recovers over years. I mean, that's the general
I've
story.
seen that.
Yeah,
Yeah, because I had a bank card repair
yeah,
and my left arm was like, this is not mine.
yeah, yeah, yeah.
I want to get rid of this.
And with knees, it disappears before you can say Jack Robinson.
Wow.
It is so quick. Um, Again, from a trivia point of view, your viewers would be very interested to know um, that knee is the only part of your human body that has not fully evolved.
Wow.
It is still an evolving part of your anatomy.
Wow.
And for instance, a lot of the primates, which is our closest neighbors. So the only differentiation between them and us is we have this. The most critical part of the knee joint is called the vastus medialis obliquus or obliquus. We are the only ones who have it. None of the primates have it. And from what we call a phylogenetic point of view, we are still in a phase of evolution as far as the knees are concerned. So maybe 200 or 500 or 1,000 years from now, the knees might look different. But as we talk today, we're still in that phase of evolution of the knees. So what that happens is because this vastus medialis is a very recent acquisition, it's a few million years old, it's always also the first muscle group to disappear.
Right.
And that's the one that actually controls the ultimate stability of the knee.
Knee.
So when you have an injury of the knee and you delay intervention or treatment, that's the first thing to go and the last thing to come back.
Right.
So that also emphasizes the need, particularly for knees, uh, to have a competent person deal with that, treat it as early as possible.
Correct. I did that first thing because I was a football player as well. And I would train my VMO because, that would bring significant stability. And I would squat like heavy weights. And I had this wonderful doctor. He's like, you know what, Asad, you squat 180 kilos. When do you get your knees checked in an MRI? Squeaky clean, beautiful.
Yeah, yeah.
Yeah. And he was like, wow. So I can double down on what you're saying 100%. So, at odds, we believe that exercise is like medicine. Um, and there is ample evidence to support all of that. Do you believe exercise should be prescribed like a medicine?
Absolutely, absolutely.
Because you have people doing like random things all the time.
I think that word random pretty much summarizes the answer. I think what we forget somewhere is somebody goes to a party and they're talking over a drink and says, guess what? I've started gymming. The next guy goes, gets inspired, finds the first gym, goes and starts pumping iron. I think exercise is a routine. It's a religion. I think we all have to understand that no two bodies are the same. Each one is different. You need to understand the limitations of what you're capable of doing. So I think here is where intelligence and guidance comes to the fore. So if you have to work out, and there are two ways to do it. One is go to the gym, get on a treadmill. You don't know what you're doing, what speed you should be running at, and just start running, or taking a barbell and start pumping iron. I think you need to understand what your goals are, how to achieve them. There is nutrition, there is stretching, there is proteins, there is the actual physicality of what you're trying to do. And I think it's very important to have somebody advise you on that.
Yeah.
So if you have not necessarily a trainer, but somebody who can guide you along that journey to from where you are today to where you want to be. And I think, you see all these sort of incredible hunks with 8 packs and 20 packs, and everybody says, wow, that's what I want to be. And you go chasing it. So there are also the downsides of training. I mean, the downsides of training is overtraining, over fatigue, damaging your muscles, not recognizing it, continuing with a damaged muscle or stress fractures, taking too much proteins, ending up with anabolic steroids. So I think that's the dark side of the development of your physique. And we see enough and more of these individuals who unfortunately have they look great,
Yeah.
but they're completely in pieces,
Yeah.
and they can barely walk. So, like I started by saying, your health, your physical health, is a state of the body and state of the mind, and you need to balance that.
Yeah.
And if you can do that, there's no better medication. You said, should it be prescribed? Absolutely, provided you can get that done sensibly.
So just to add to that, we have like 300 people with odds who we get trained. And, I see so many guys who, he's very excited about exercise at 10%, 9% body fat, and they've maintained it over a long period of time. And because they found their, gross estimate of achieving their goals through what they perceive through the mirror or whatever it is, they don't know what's happening in their body. So when we get their test done, they're like zero on sex hormones. And like, we're like, okay, you know what? That's a disaster. We need
Okay.
to fix that. And they complain of low energy, just exactly what you said. And I'm like, you know what? Testosterone is not just about, uh, being a man. That's the first thing that
Yeah,
they
yeah.
take to them, but it's also about so many other things. It's a critical hormone. And, I don't see this as fitness.
Yeah.
So I think you're absolutely right there. I think people should have some method to the madness.
Yeah.
100%. So, uh, what do you think? Because you might have had like a lot of gym goers and sportsmen, like you said. What do you think they fundamentally do wrong? Is it overtraining? Is it, I don't know, the lack of knowledge that, sort of supports whatever it is that they're doing? What would you change if you were to say, like, okay, three things to every gym goer or everyone who wants to be fit or every sports person?
First thing is education.
Okay. Yeah.
I think they need to educate themselves. Um, you want to do something. The first thing is to understand how to go about it.
Yeah.
And I think you touched about this. So many of the parameters that are needed to be monitored you need a baseline. You need to understand where your start point is. The second thing is to be trained properly. And the third thing is your diet and nutrition.
Yeah.
And last, I think it's also very important to sleep well.
Oh, 100%.
If you are training or you're doing your diet stuff, you're not sleeping. So sleep is a very interesting phenomenon. I mean, different people have different yardsticks for sleeping. Um, if you look at the general body of belief, everybody says adult 8 hours. I'm not sure that works for the majority of people. A lot of people sleep very little. I sleep 4 hours a day.
Wow.
And, I do all my stuff. But to answer your question, I think you need the human body, like I said earlier, is a very individual piece of art. You need to sort of understand that art. You need to sort of uh, preserve that art, and you need to grow that art. Now, that art can be, going out and doing all the stuff in the gym, running, weights, Pilates, yoga, Zumba, whatever. But what is important is for you to understand that your body uh, habitat, as it were, is peculiar to you. So, like I said, you start at your start point, you have a end point or your goal, and you need to traverse that distance with intelligence, with guidance. And a lot of people I speak to, they say, oh, I go and I do deadlifts with 140 pounds, 140, 50 pounds. Is that the best thing? And I think the fact that you have trainers who are intelligent, who and you need to get the right trainers, because that's the other thing. Right now, everybody is a trainer. You go to a gym and there are like 300 guys there, and there are 40 guys who are there. You need to make sure that whoever is guiding you or helping you is the right man. He knows what he's talking about.
Right.
I've been to three or four, five gyms, and somewhere along the line, they after a while they say, I think you need to get onto these medicines. And you're like, why?
Yeah.
So the abuse of, because they see your aspiration, they see that you're getting there but not getting there, then they start pushing you in that way. So I think this has it's you're trying to build health, and it's got to be done in a healthy manner.
Yeah.
Now that healthy manner is really a open-ended statement. You need to figure out in your head, what does that healthy manner mean to you? You, because there are gyms and trainers and trainers and trainers. You pick the guy who you believe is going to think for you,
Yeah. Who's on your side?
who's on your side.
Right. So true, so accurate. That's sort of the problem that I struggled with as a kid. That sort of is what led me to, exploring this space altogether. And I got so curious. Like you said, this is exactly what I struggled with: education, proper training, diet, sleep. I had to figure out things for myself the hard way.
Yeah.
And then, of course, my formal education was inspired because there was a need and a lack of. So yeah, that's absolutely true. On sleep, I think a lot of people neglect it. Some people think that grind culture is needed. They support the whole idea,
Yeah.
right? That sleep less, do more. But I see that that's getting to a toxic state almost. And maybe India needed it for a short while, maybe, to get more done in very
Yeah.
little time. I think it was important. So I think for everyone, they should choose.
Absolutely.
Do you really need this?
Yeah.
And if you do, how long are you going to do it for? Because there's only so much that the body could
Yeah.
deal with. And I was reading this book the other day. If sleep was not so important, evolution would have removed it.
Quite right.
Because you're pretty much useless when you're sleeping.
Yeah,
Right?
yeah.
Okay. So I think now we've spoken about so many of these things. Let's talk a little bit about technology. Um, could you highlight a few technological developments in orthopedics, in medicine, uh, with the growing trends in AI, and also how lifestyle is sort of changing? Could you tell us a few cool things about?
So let's look at lifestyle first of all. I think one of the nice things that's happening, but the whole world is moving towards corporatization.
Yeah.
And one of the things that we get approached a lot at our institute is a lot of these corporate head honchos reach out to us and say, "Can you guys come and give like a awareness talk on stuff like posture, yoga, and this, that, and the other?" And I see that growing.
Yeah.
So the fact that the corporates are getting concerned because the burnouts are happening so frequently.
Yeah.
Uh, a person who's got a backache has to take leave, it's time lost, time off work. One of the commonest things that we are seeing is this carpal tunnel syndrome.
Yeah.
They're not able to use their fingers, they complain. And these are young adults. I mean, they're in their 30s and early
Wow.
40s. And obviously, when they're not functional for a corporate, that is pretty much a dead loss. So I think people are beginning to waken up to the fact that um, s- professional attitudes or postures are impacting their efficiency.
Yeah.
So somewhere they're beginning to recognize, if you can improve that, the efficiency improves, the top line improves. So somewhere there's a commercial interest in that as well.
Right.
Having said that, in terms of when you look at pure the medical advancements, I think it's been huge. As I said, the first thing is the diagnostics. Today we can actually pinpoint with great accuracy exactly where the problem is. We are able to identify it. There are various modalities. You have various MR systems. You have ultrasound systems. They can pick out soft tissues. You can pick out hematomas. You can pick out it's 1.8 millimeters rupture. That's how precise
Wow.
we've gotten. We're able to track the progress. We're able to track the improvement in muscle strength, fatigue levels, fatigue points. We're able to do that. We can selectively isolate muscles and rehab them rather than when you look at the quadriceps, four muscles, you can take out a muscle, a segment of that muscle, and just rehab that part.
Wow.
So that's as far as the conservative part of it, and some of these, a lot of these machines are like you mentioned the AI part. They are AI driven,
Yeah.
so we can monitor the progress. And what's very interesting is that the athlete himself or herself can see the improvement or the lack of improvement, and she then knows that this is really not getting better. Oh, I'm getting better. So I think that's also an added more motivation. Then we come to the surgical part, and this has absolutely exploded from where we were when we operated in Gopi. Our scope and ambit of what we could offer the athlete was very limited. Today, we have the most amazing technologies, and all of it is endoscopically driven. I mean, today we can pretty much recreate the whole knee, the whole shoulder, the whole ankle, the elbow without actually opening it.
Wow.
So we have very, very good navigation systems. We have absolutely amazing viewing options. We have these high resolution cameras. The scopes are as little as 1.8 millimeters going up to about 4.5 millimeters.
Wow.
And the instrumentation, we can reattach stuff inside the knee without opening it. There are a lot of these anchors. They're like little titanium. They're like fish hooks, if you
Yeah, I
will.
have them.
Yeah, you have them. Yes, that's why I was mentioning that.
Yeah.
So like you had a bank card. So a lot of this, and a lot of these athletes, for instance, they dislocate their patellas. Particularly young women, you can put one of these suture anchors there and reconstruct the MPFL. So from a surgical perspective, that's been the improvement. And finally, of course, the rehab processes and the nutrition, the psychologists. So you put this athlete from stage A to Z, and you got the whole thing covered.
Doctor, on that note, because athletes are so fit, they usually come in quickly. They want to get back in quickly. Maybe they don't need, you know, uh, any sort of foundational work before a surgery, like prehab,
Mm-hmm.
right? But when it comes to, let's say, somebody who's untrained, right, arthritic knees, um, damaged cartilage, do you think it's important for them to have like a
So,
pre-surgery routine?
so people who have damaged cartilages are pretty much see one of the sort of amazing things about joints is cartilage is almost impossible to grow.
Yeah.
It has such a low metabolic rate. There are assortment of pills, surgical procedures, cartilage. You can harvest the cells, grow it in a lab, pump it back in. None of them have really, even at the expense of offending my colleagues who believe in this philosophy, it's not been the golden goose that people thought it would be.
Yeah.
It works, it helps. But can that athlete regain enough cartilage to go back to elite level sports? The answer is no.
Yeah.
And I think that's, which is why I think it's critically important that when you get these injuries at the early stage, when the athlete is still, say, in his mid 30s and he's got the wear and tear, that is the time when you plan his surgery in such a way that you try to put in stuff rather than take out stuff. I mean, back in the days when I was training, the treatment of a torn cartilage was to remove it. Today, 85 times out of 100, we repair the meniscus. It's a very, very infrequent situation where the meniscus is so badly hammered up or chewed up that there's no way we can. So today, efforts are being done to actually put back suturing meniscus, suturing, like in your case, the labrum was sutured. Back in the days, we did nothing with the labrum. We just cobbled up the muscles. It was to be called the putty plat operation.
Wow.
So a lot of technology has changed in that way, and now robotics is coming in. Now, for instance, when you do a shoulder surgery or a ACL or PCL surgery, where exactly should that ligament be attached? It's a big spot. You have a 1 centimeter knot. Does that precision matter? The answer is yes,
Yeah.
it does. And your interpretation of 1.2 would be different to mine. The robot will actually be able to do that for you. So robotics is coming into sports medicine. We are not there yet as we speak today, but I predict that in the next 2, 3, 4, maybe even earlier, robotics will play a pretty integral part in the surgical management of lot of these injuries.
Wow. Amazing.
Management of health and fitness is a multi-directional approach, and there's no one question that answers the whole
Yeah.
circle.
100%.
And I think we need to understand and recognize that every individual is different, every need is different, every approach is different, and every joint is different. And if you can collate all of these stuff together, then hopefully you'll get a happy person, fit person, and a mobile person.
Super. Super. Anything you want to ask me?
Yeah, you're looking great.
Thank you so much, Doctor. Thank you so much. So, on that note, we conclude this podcast. I think we definitely. I'm so inspired from a couple of stories he told me about himself going into a volcano and skydiving at the age of 70. Like, wow. And there's this another doctor, Dr. Kubba. I always ask these guys, what keeps you so young and alive and at your practice? And I think it's about balance and the right attitude and right mindset. I see
Good
that.
idea.
I see that. Amazing. Thank you so much for being
Thank
here.
you, Asad.